Hello. In my first video, I told that I will discuss about McLeod's clinical method and Hutchinson's clinical method. And this is my next video, that is my second video, where I will discuss about the initial chapters of these two important books for clinical learners and also for postgraduate doctors. The first chapter of McLeod's clinical method is managing clinical encounters with patients. I think this first chapter is about clinical encounter, and this correlates with the section 4 of chapter 1 of Hutchinson's clinical method. There is no alternative of reading text. You have to read text for your exam purpose or clinical purpose. But I can give some hints about important points of this chapter. The points that is most important, that are important. You have to consider that what is the reason for encounter with the doctor. The first thing is you have to consider the triggers to consider consultations. There is some interpersonal crisis and interference with social and personal relations, sanctioning or pressure from family or friends, interference with work or physical activity, and reaching the limit of tolerance of symptoms. These are the factors that makes the patient to come to you for a clinical encounter. This has to be considered. And here you see a picture of a good clinical environment. The first picture is about positive phenomena where the doctor and patient is sitting at an angle and closely, and the second picture is for an adverse environment, that is across a desk and doctor is moving away from the patient. This picture has taken from McLeod's clinical methods. And another thing is very important to me, that is opening the encounter. Here are discussion about some important point, that is rapport build-up. Greeting the patient and introducing yourself and describing your role clearly, and a friendly smile helps to put your friend at ease. Your dress, that is smart, sensitive and modest dress, wear short sleeve or roll long sleeves up away from your wrist and forearms, particularly before examining patients or carrying out procedures. Avoid hand jewelry to allow effective hand washing and reduce the risk of cross-infection. Tie back long hair, and you should ensure that the patient is physically comfortable and at ease. And the other points are I am not considering to mention here. That is, there are some professional responsibilities, the duties of a registered doctor. There is a long box, and important point I have to mention you may face in clinical exams. There is social media use for a doctor. That is, there is the intermingling of clinical life and personal life when you making contact with your patients through your social media for clinical purpose also. So you may be in danger when you use this method. If patients contact you about their care or other professional matters through your private profile, you should indicate that you cannot mix social and professional relationships, and where appropriate direct them to your professional profile. To mention here that ethical considerations are detailed discussed in medicine textbooks. So for facing clinical examinations, you have to go through the textbooks. The important point here in Hutchinson's clinical method, there is a long discussion about giving consent, and I will mention here the point what you will do when there is a doubt that the patient is capable of giving consent or not. So here is some criteria for having mental capacity. The patient can understand what has been explained. The patient can recall and repeat what has been explained. the patient can discuss what has been explained and weigh information. The patient can communicate the decision that has been made, helpful for you when you have read these chapters once. Thank you, and in the next video I will discuss about general considerations, general aspects of history taking.